Hello everyone, my name is Feng. I am Senior Research Fellow from University of Tasmania. Today I want to talk to you about a common issue that affects many people, which is about musculoskeletal pain. Whether it's a change in your back, a sore knee, or persistent ache, musculoskeletal pain can be a real nuisance. What's the musculoskeletal pain? Musculoskeletal pain refers to discomfort or pain that affects the muscles, bones, tendons, ligaments, or joints in our bodies. It can result from injuries, overuse, or medical conditions like arthritis. So musculoskeletal pain is very common, particularly in the elderly, with a prevalence rate of as high as 74% in community-based older adults. Musculoskeletal pain can vary greatly from person to person. There are some key factors contributing to this variability, including the individual differences, like what causes pain is different from person to person. Pain threshold, like some people may have a higher pain threshold, meaning they can tolerate more pain before it becomes bothersome. Psychological factors, because of emotions and stress level, can influence how we perceive pain. We can define different types of musculoskeletal pain based on different definitions, each with its characteristics and causes. Like we can define pain by its duration, including acute pain and chronic pain. There are also potential mechanistic pain definitions, including nociceptive pain, neuropathic pain, and nociplastic pain. Or we could simply count the number of pain sites to define single-site pain and multi-site pain. Multi-site pain is often defined as pain occurring in multiple sites simultaneously. Multi-site pain is more common than single-site pain, with a prevalence up to 80% in older adults. It has been linked to worse physical and mental health compared to single-site pain. We have explored the underlying mechanism of multi-site pain. Using targeted metabolic profiling, we have identified and replicated one lipid metabolite, which is sphingomyelin, associated with multi-site pain in two independent cohorts. Also, using lipidomics techniques, we further identified several lipids related to persistent multi-site pain. These findings together may suggest metabolic mechanism may be a key factor in driving the development and the maintenance of multi-site pain. We also validated the clinical utility of multi-site pain by demonstrating its relationship to a range of health outcomes. For example, we looked at whether people with multi-site pain had a high risk of dementia in a larger population-based cohort study. So from this figure, you can see people having greater number of painful sites had a high risk of incident or cause of dementia and Alzheimer's disease compared to those without chronic pain over 13 years of follow-up. We also looked at the relationship between multi-site pain and the incidence of cardiovascular disease, including myocardial infarction and stroke, based on a prospective cohort study. You can see from this right figure, increasing in number of painful sites was linked to a high risk of incident myocardial infarction and stroke over 12 years of follow-ups. In this study, we also used the Mendelian randomization method to determine the causality of the relationship between multi-site pain and the incidence of cardiovascular disease. Mendelian randomization is a method using measured variations in genes to examine the cause effect of an exposure on disease, because our genes are randomly determined and not influenced by the external factors like environment or lifestyle. So the Mendelian randomization result supports a causal effect of multi-site pain on myocardial infarction risk. There is already one study using post-hoc analysis of a phase 3 RCT in knee osteoarthritis patient, suggesting the possibility of using multisite pain for targeted pain treatment. As you can see from the right side figure, this figure is for the duloxetine in patient with pain site less than 3, and the right side figure is for the patient with 3 or more painful sites. We can see duloxetine was more effective in pain relief in patients with 3 or more painful sites. So taken together, multiple site pain is highly prevalent, affecting many individuals. Given the differences in underlying mechanisms and its clinical prognosis, this finding together may suggest multisite pain is a distinct pain phenotype, which could serve as an easy and accessible tool to classify the patient for targeted pain care. Thank you for your attention.